Welcome to joining us with us for continuous learning with Bioguard. And I'm today's lecturer. So let me share my PPT with you. Today, we will share canine leptospirosis, the essential facts you should know. Before we start today's lecture, let me briefly introduce myself. I'm Yung-Tsun Lo, or Robert. I got my DVN degree and master degree in Taiwan and PhD degree from Mississippi State University. After I got my PhD degree, I went to University of Florida as a postdoc to do some gene therapy. After that, I came back to Taiwan to work as the Bioguard Animal Disease Diagnostic Center Director. Currently, I'm the Diagnostic Specialist in Bioguard. And this is some of the patent I have in Bioguard and a book co-authored with other vets. And before we start today's webinar, I would like to invite you to follow Bioguard's Facebook and LinkedIn. And we publish lots of knowledge-based information and also some product information on our company's social media. So I would encourage all of you scan the QR code and following us. So now I'll start today's lecture. For leptospirosis, it's a zoonotic bacterial disease with a globally distribution. And in human, every year, more than 1 million people got the Leptospira infection. And in this situation, it costs 60,000 deaths per year in humans. And in this disease is prevalent in dogs. It especially affects those small breed dogs from urban areas and also the puppies as young as 11 weeks of age, and also those elderly dogs and dogs in rural areas or dogs that have not been adequately vaccinated against the Leptospira. And by the way, actually, all the dogs, one thing you need to keep in mind, all dogs are at risk of leptospirosis, regardless of signalement, geographic location, lifestyle, and the time of the year. So it's just highly prevalent, and all the dogs at every age, every kind of age can be infected. And also, cats may be an under-recognized source of pathogenic Leptospira in some regions and should be considered in One Health investigation that employ sequencing typing method to advance knowledge of disease epidemiology. And for Leptospira, because it's usually human or animals are got from those contaminated water, and usually occurs in increased rainfall, like after the heavy rain, is especially easy to happen, and it can occurs in standing or moving waters. And for soil, a little bit neutral or little bit alkali environment with moisture greater than 20% are more easy to have the Leptospira. And it can survive greater than 28 days in stagnant water and greater than 16 days, longer than 16 days in moist soil. And this pathogenic Leptospira can replicate in water-large soil by forming the biofilm. The biofilm actually is a layer. You can see it's a layer of the bacteria grows on some material like soil or some biological material. And once the biofilm form, the bacteria can survive in that situation for a long time. And it can also survive in freezing situation. So in the environment, it can survive for a long time. And speaking of the etiology of Leptospira, the genus of Leptospira belongs to the family Leptospirosis in the order of Spirocatitors. There are two types of classification coexist, one based on genetic and one based on antigenic determination. Both recognize pathogenic and saprophytic species, but serologically indistinguishable strain may belong to totally different species according to the genetic classification. So let's check the taxonomy of Leptospira. In previous page, we just mentioned there are two different kinds of classification. One is based on the antigenic of the bacteria. That's what we call serological classification. It's based on the outer lipopolysaccharide antigen. And right now, currently, there are more than 300 different seroba and in Leptospira. And for those seroba, some related serobas are organized into antigenically related cell group. And the issue with the serological classification is the same seroba can be found in multiple different species, and each cell group often contains a seroba with the same name, like seroba gripotiposa, cell group gripotifosa. And the other issue is some species contain both pathogenic and non-pathogenic seroba, and several serobas are found in more than one species. However, the serological classification is still important because it's important in the vaccine development and vaccination because they are classified based on similar the antigen similarity. And for genetic classification, at the beginning, those are based on the cysteine sRNA sequence, and then they can be divided into three groups: pathogenic, intermediate, and saprophytic. And then when the whole genome sequence are getting popular and the genome and using the next generation sequencing methodology. Nowadays, that's the whole genome of the Leptospira have been sequenced. So the newest genetic classification is based on the whole genome sequence, the DNA sequence compositions of those Leptospira. And in a study, they use 68 species of Leptospira have been identified at that time, and to compare their DNA sequence composition. And based on those comparisons, they classify the Leptospira genus into two major clades, the pathogens and saprophytes. And each clade are also divided into two subclasses. Like for pathogen, it have a P1 and P2. And the P1 is what we call the previously pathogenic Leptospira, and P2 is the previous intermediate based on cysteine sRNA sequence. And for S1 and S2 are the previous saprophytic Leptospira. And this table is summarized some of Leptospira serogroup and seroba isolated from dogs suspected to have the leptospirosis, or that induce the disease after the experimental infection. And there are over 250 pathogenic serobas based on difference in the bacterial lipopolysaccharide. And different seroba are adapted to different wild or domestic animal reservoir host. And thus, seroba recognition has epidemiological importance. Those serobas are further grouped into antigenically related serogroup, and immunity to Leptospirosis is serogroup specific. And knowledge of serogroup, like shown in this table, commonly cause disease within a particular geographic region is important for machine development. So here just list some serobas and isolate from dogs, and their the species and the serogroup and their seroba, and identified countries here. And then let's take a look at the structure of the Leptospira. The Leptospira is actually helical cell. The morphology is like a helical cells with hook-shaped ends, and the existence of periplasmic flagella over here. And it have a double membrane structure consisting of a cytoplasmic membrane here, and which is surrounded from the outside by an outer membrane. And it's what we call right-handed spiral cell body. And that's in this figure here, that's the swimming direction for this Leptospira. And the pathogenicity of Leptospira is closely related to the cell motility and mobility. and cell motility. As mobility decrease, accumulate this spirus virulence. That means with less mobility, have a higher virulence for Leptospira. And in the transmission, how the Leptospira transmitted? For Leptospira, it's unlike other spiral chains, such as Borrelia burgdorferi and Treponema pallidum, which are obligate parasite bacteria. And for pathogenic Leptospira, they can survive in the environment as well as within the emphatic vertebrate host. And for natural reservoirs are in environment, are in most cases asymptomatic rodents. Over here. So for mice and rats are considered as resistant hosts that are chronically colonized in their kidney upon infection and can persistently excrete the bacteria in their urine. And then once it contaminates the water or soil, then it can transmit, infect other hosts. Once excreted in the environment, Leptospira can infect susceptible hosts, such as humans, cattle, and pets. And for cattle are susceptible hosts, they can also undergo some vertical transmission. And infections occur through abrasive or damaged skin and mucosa in the host. Leptospira can cause a systemic infection, leading to severe illness in some cases. And furthermore, the venereal transmission has been suggested in infected cattle and goat. And not all Leptospira SPP are pathogenic. And recent genomic study have reclassified and clustered more than 60 species in group and clade according to their pathogenesis in human and animal host. So that's what we just mentioned, the P1, P2, and S1, S2. So once the Leptospira invade the host through mucous membrane, skin lesion, or those maculated skin, it will enter the bloodstream and rapidly disseminate through the body. And once they get into blood circulation, the Leptospira can evade innate immune recognition and defense mechanism, and use their corkscrew motion and to embed host tissue at gel liquid borders, then binding to vascular endothelial cadherin to weaken endothelial barriers. And then the breakdown of the endothelial barrier may lead to Leptospira pulmonary hemorrhagic syndrome, the LPHS, in dogs and other species. And the leptospirosis primarily cause acute nephritis and liver dysfunction, but it can affect multiple organs. And because they can affect multiple organs, so here, this table just summarizes the clinical manifestation of leptospirosis in dogs. And the most common one is the most common organ involved is the kidney, like in can see the acute kidney injury. And then it's cholestatic hepatopathy. And once, if the kidney have the acute kidney injury, then the possible clinical sign may include vomiting, diarrhea, dehydration, lethargy, inappetence, polyuria, polydipsia, and oliguria, anuria, and abdominal pain. If it causes the liver issue, can also see the vomiting, diarrhea, dehydration, lethargy, and jaundice, and may cause the Leptospira, pulmonary hemorrhagic syndrome, can see the tachypnea, hemostasis, and increased breath sound in the infected dog. And it can also cause the coagulation issue and can see the pathology, hematuria, melena, and epistaxis, and can also damage the blood vessel, cause the vasculitis, and as a result, may have a mild ascites, granular effusion, and some peripheral edema, and may also affect the pancreas, causing the pancreatitis, or also affect the eyes, causing the uveitis, conjunctivitis, and also may affect the heart, causing the myocarditis, and affect the GI tract and muscle, also the reproductive tract and skin. So it can cause multiple organs issue if the dog infected with the Leptospira. Of course, it also those organ involved in the Leptospira depends on the seroma of the Leptospira infected. And for the reservoir host, the most common, the most important one is the rodents, and it's a worldwide prevalence for the rodent to be the carrier. Based on the study, 30% of rats are infected with pathogenic Leptospira globally. And other carriers based on different studies, other carriers have been identified, including like in mammals, like cats, and in reptiles, in turtle, and even amphibians can also carry the Leptospira. And this two figure, just the figure here, we can see the quantity of shed Leptospira per milliliter of urine. You can see that's in cow and in deer are high, and also in the highest is the rat. And dog, although dogs also infect can be infected by the Leptospira, but the shedding of the Leptospira from dogs is actually quite low compared to other carriers, and even lower than humans. And figure B here is the estimate the absolute quantity of Leptospira shed per day, and same thing. Because like cow and deer, because they have more urine per day, so the total amount of the Leptospira shed is high in cow and deer, and rat is still high because the quantity of shed Leptospira per milliliter is high in rat, and that's in dog. It's still lower compared to other animals. And for the diagnosis of the leptospirosis in dog, it actually includes the complete physical exam because of the it have some non-specific symptoms, and so all the tests, the signalment are important, and also the blood chemistry are also important for in diagnosis of the Leptospira, because previously we mentioned that based on the emphatic strain of the Leptospira, it may cause the kidney injury, liver damage, or issue in other, like in muscle, in heart, in lung, in pancreas. So the blood chemistry tests are also important. Like if have the acute kidney injury, may see the BUN increase, creating increase, and phosphate concentration also increase. If have a liver issue, we will see the increased liver enzyme activities, especially for ALP and some like also ALT and AST. And because it will cause the kidney issue, so urinalysis are also important because the have seen urea or minimal concentration and proteinuria, glucose urea may also happen, and cylinderuria, hematuria, or pyuria. And in Bioguard, we have a machine, the mini can detect can check both blood chemistry and coagulation function of the animal, and using the liver function panel or kidney function panel, or even the electrolyte panel may help to identify those kidney function, liver function in the animals. And the leptospirosis should be considered a differential diagnosis in any dog evaluated for acute kidney injury, and especially when accompanied by hepatic dysfunction or evidence of pulmonary hemorrhagic. So the application of a combination of serological assay and organ detection test is recommended to optimize diagnosis of leptospirosis. Other diagnoses like thoracic radiographies are also important because those radiographic changes can indicate the severe pulmonary form of leptospirosis with hemorrhagic, typically developed bilaterally in the dorsal lung field as a mild intestinal pattern and progressing to a reticulonodular pattern and to focal or generalized alveolar infiltrates. So the thoracic radiography is recommended in all dogs suspected to have leptospirosis, even in the absence of respiratory sign, because radiographic finding consistent with LPHS can aid in diagnosis of leptospirosis and should prompt judicious fluid therapy and close monitoring of respiratory function. And in lab diagnostic, the microscopic agglutination test, the MAT, that's the reference standard test for the leptospirosis, or the so-called gold standard test. This is detecting the antibody in the patient's serum. Can make the serial dilution of serum reacted with an array of live Leptospira serobas and assessment of organism agglutination by dark field microscopy, like the figure shown here. You can see the agglutination here, the clump together. And of course, this method still have some limitation. And the diagnosis of leptospirosis based on a single positive MAT test result is not recommended. Because in the first week of illness, dogs frequently have a negative MAT result. And consequently, acute and convalescent phase antibody testing is recommended for this MAT test. So, although seroconversion, like a greater than 4-fold change in titer, can occur as early as 3 to 5 days after dogs are presented to the vet. An interval of 7 to 14 days is recommended between acute and convalescent phase sample to identify seroconversion. And the limitation for the test, the false negative may happen if it's in the early or seroba in the early stage of the infection, or the seroba is not included in the MAT test, and you may get the false negative result. And if the dog have been vaccinated before, the MAT test will recently vaccinated recently, the MAT test will also show positive. So that's why usually require serum for the confirmation of the leptospirosis in MAT test. And for point of care test like ELISA or rapid test detecting IgN or IgG antibody is also common used in the clinic because it's easy to do the screening test to identify if the dog have IgN or IgG antibody. And the limitation is similar to the MAT test. And the other way to do the lab test is the PCR or the qPCR test. The PCR can detect nucleic acid pathogenic Leptospira and has potential utility early in the course of untreated infection when antibody assays are frequently negative and antimicrobials have not been administered. So one thing important is need to collect the sample for, if you want to do the PCR test, need to collect the sample before the treatment started. And in the first 10 days of infection, the Leptospira numbers are highest in blood. So in this time, the blood is the sample of choice during the first week of illness. And after that time, leptospiras are present in highest concentration in urine. And when the time of infection is unknown, simultaneous testing of blood and urine may increase diagnostic sensitivity. Means just if we don't know which stage of the infection is, simple. The safest way is just collecting both blood and urine and send to the lab for the PCR or qPCR test. And because the DNA of pathogenic leptospirosis can be found in the urine of up to 20% of those apparently healthy dogs. So a positive PCR test on urine must be interpreted in conjunction with clinical signs and the results of other diagnostic tests. But if it's detecting from the blood, it can help to make the definitive diagnosis. But if it's detected from urine sample, need to also check the clinical signs and other the results of other diagnostic tests. And in Bioguard, right now we have a in-clinic real-time PCR instrument to help to fasten the testing of PCR in clinic. In clinical qPCR, you can do those PCR tests in your clinic, and the Q-mini detection kit can also detect the Leptospira, the pathogenic Leptospira using the blood or whole blood or urine sample. And this figure just summarize the diagnosis. How to use different diagnosis to to diagnose different method to diagnose the leptospirosis. That's the time course of leptospirosis in patient. We can see is the incubation period. The incubation period depends from some say 2 to 14 days, and some say 2 to 20 days. It's actually up to the host immunity, or also the emphatic strength, or the bacterial amount during the initial invasion. And then the PCR can detect the first 10 days using the blood, the Leptospira present in the blood. So at this time, using the blood as the sample detected by the PCR or real-time PCR is the best choice. And after that, the Leptospira will present in urine. So at this time, using the urine as the sample for PCR is the better choice. And if not sure the time of the infection, just collect both blood and urine for the PCR test. And then after 2 to 3 weeks of infection, the antibody level will start to getting high and can detect the IgM, IgG using the MAT or the point of care test. And also for bacterial culture, if we want to send a sample to reference lab for bacterial culture, similar to the PCR test, collecting the blood sample for blood culture in the first 10 days of the illness appear, and then send the urine sample for the bacterial culture later, or just collect both blood and urine for the bacterial culture. And of course, bacterial culture is not easy for the Leptospira. So if you want to do the Leptospira bacterial culture, you need to send to the reference lab with some authority. And for bacterial culture, both bacterial culture and PCR test, remember collecting the sample before the antibiotic treatment. In this way, can increase the sensitivity of the Leptospira detection. And this table just summarizes a comparison of the tests used to diagnose Leptospiras in dogs. We can see the MAT. First is MAT test. That's what we call the gold standard. So it may have a false positive because of vaccination or the exposure, previous exposure, but the dog don't have the disease. And false negative may happen early in the course of acute phase, or may happen if the serogroup is not included in the MAT test. And for PCR test, it's the rapid, we can get a rapid result. And may have a false positive in subclinical carriers, or like dog or the dead, detecting the dead Leptospira. And for false negative may happen if the sample has a low Leptospira number, or because of the intermittent shading of the Leptospira in the sample. And this is PCR test is most useful when combined with serology testing. And for bacterial culture, we just mentioned because of technically demanding, so it's not widely available, and also need long turnaround time. So it's not often used clinically because it takes for a long time. It's time consuming. And after all those different diagnoses, using different methods to diagnose the Leptospira, there's some case definition for leptospirosis in dogs. So for a probable case, need to meet the clinical criteria and has one or more than one supportive lab criteria. For a confirmed case, that means if we want to confirm the leptospirosis of the dog, need to meet the clinical criteria and also one or more than one confirmatory laboratory criteria. So let's check what's the clinical criteria. For this need to meet both criteria 1 and criteria 2. The criteria 1 is the onset of systemic illness, like a non-specific fever, lethargy, polyuria, polydipsia, anorexia, or some combination of those signs within the past 2 weeks, with or without other clinical signs suggestive of leptospirosis. The other clinical signs, like including the intestinal sign, pulmonary signs, ocular, and clinical suspension for AKI, and jaundice or hemorrhagic signs. And for criteria 2, just remember, need to meet both criteria 1, criteria 2. For criteria 2 means 2 or more of the following clinical pathological abnormality, like including the neutrophilic leukocytosis, with or without a left shift, thrombocytopenia, and also the biochemical evidence of AKI or cholestatic hepatopathy or pancreatitis. The third others like increased CK activity or the glucosuria despite the normal glycemia, or the active urine sediment, or the radiographic finding consistent with the pulmonary hemorrhagic syndrome, and also abdominal ultrasonographic finding consistent with leptospirosis, like finding supportive of pancreatitis or the hypertrophic renal cortex or the perirenal fluid. And also the ECG documented cardiac arrhythmias or increased serum troponin concentration, all fit in the criteria 2. As long as there are 2 or more of those abnormality, that means it meet the requirement for criteria 2. And for laboratory criteria. The supportive of lab criteria include the Leptospira MAT titer greater than 800 in more than one serum specimen, or detection of IgM antibody against Leptospira in an acute phase serum specimen, or detection of the pathogenic Leptospira in urine using a PCR, which previously we mentioned. In 20% of the clinically healthy dog may also shed the Leptospira in their urine. So that's why for the detecting using the PCR detect the Leptospira from urine is just a supportive evidence. And the last one is visualization of spiral cell in a blood or urine specimen using dark field microscopy by a reference lab. That's the supportive criteria. And for confirmatory criteria, including fourfold or higher increase in Leptospira agglutination titer at a single lab between acute and convalescent phase serum specimen, or detection of the pathogenic Leptospira in blood sample using the PCR or qPCR method, or isolation of Leptospira from clinical specimen by a reference lab. And of course, this one is not easy. So let's go back. So for the probable case, need to meet the clinical criteria and one or more than one supportive lab criteria. For a confirmed case of leptospirosis, I need to meet the clinical criteria and has one or more than one confirmatory lab criteria. And once the diagnosis after the diagnosis of leptospirosis, the treatment is like including the antimicrobial therapy. Usually it's the doxycycline, and others are the supportive care, like a fluid therapy, blood pressure management, on the antiemetics and gastroprotectants, or even the nutritional support, pain management are also important. And supplemental oxygen therapy, mechanical ventilation, short-term kidney replacement therapy, or even the dialysis in severe case may also be required. And I think for the treatment, you are more familiar with than me. So I just show just list the treatment option here. And for dog, if the vomiting or other adverse reaction preclude doxycycline administration, dog with leptospirosis should be treated initially with like ampicillin, amoxicillin, or penicillin G. And based on the marked morbidity and potential mortality of the disease and the risk of zoonotic transmission, dog with suspected or probable leptospirosis should be treated with appropriate antimicrobials. And then during the treatment, should still keep monitoring the response to the treatment. And at the minima monitoring, need to monitor the kidney function, bilirubin concentration, liver enzyme activity, serum protein concentration, CRP, and electrolyte and acid-base status every 24 hours. And also PCV every 24 hours and CBC every 48 hours. And of course, more frequently is recommended. Here, just say the minimal requirement. And the best prevention, of course, is the vaccination, and also don't let the dog to play with those water with like still water or some water after the if we are not sure if it's clean source. And for the vaccination, there are some quadrivalent vaccine available, like for in different area may have containing the vaccine may containing different seroba, and like in America have the this four seroba in a vaccine, and in Europe and some other country have this four seroba, like the only difference here is the Pulmonary and Australia's. And the monovalent, bivalent, and trivalent vaccines are also available in many geographic locations. And of course, if the more seroba included in the vaccine may cover more protective range for the dogs. So if the quadrivalent vaccines are available, better to use it. And this vaccine need to have 2 initial injection and then followed by annual booster to let dog have a good immunity to protect them from the Leptospira infection. And for public health consideration, because the Leptospira is the zoonosis, so the Leptospirosis in humans most often is subclinical and presents as an influenza-like illness, and is prevalent in regions with high humidity, high rainfall, and flooding areas. And globally, rodents are the main source of infection. If you still have remember the figure, the two figure, we see the shading of the urine, the Leptospira shading from urine from different animals. Rodents are the main source of infection. And free-rolling dogs may represent a reservoir of infection for humans, although realistically, the infection, the Leptospira transmitted by dog to human is actually not that common. And especially when basic precautions are taken. So that's it for today's lecture. If you have any questions, by the way, if you want the seminar slide for PDF files, please leave your name and email. Yeah, please leave your name and email for it. Yeah, please leave your name and email, and then we can send it to you. And that's one question. How is the best to culture Leptospira from specimen? We mentioned because the Leptospira will exist in blood and urine. So when the clinical signs show up, the first 10 days, blood is the best specimen for bacterial culture. But for blood, we need to collect blood for blood culture. And blood culture requires specific, we call blood bottle. So if you have some cooperate reference lab, they are doing the bacterial culture, you may need to get the blood bottle from the reference lab and then collect the blood, inject the blood into the blood culture bottle, and then send the whole blood culture bottle to the reference lab. And also, because after the first 10 days, the Leptospira concentration will be high in urine and low in blood. So at that time, urine is the best specimen for bacterial culture. So at that time, you need to collect urine. And the way to collect urine, yeah, please also contact the reference lab. You want to send the sample for bacterial culture. If you are not sure which stage of the leptospirosis is, then better to collect both blood, collect the blood into the blood culture bottle and urine into a clean and sterile container and send both samples to the reference lab for the bacterial culture. And just if you can just leave your name and email address in the Q&A session here, and we are collecting the information and send a PDF file to you after the webinar. Yeah, just leave your name and email in the Q&A session here. And the other question is, what diagnostic tests are considered gold tests for lepto? Currently, MAT is considered the gold standard test because like sometimes if the dog want to auto travel abroad to some countries, then some countries may ask the dog to have a MAT test before they can travel. So currently, MAT is the gold standard test. Also have some limitation, but it's still considered a gold test for the Leptospira. And a question for leptospirosis vaccination, because they have a different serova for every continent, will it be eligible for a pet passport before they are sent abroad? Will it still protect them from possible leptospira infection abroad? This one, it can only protect from those closely related antigen. antigenic seroba. It cannot protect from others. So if the dog want to travel to some countries, you already know there's a specific Leptospira that cannot be protected by the vaccine. Then when the dog travel to that area, better to watch out the dog, not let it have a close contact with rat, with some wildlife, and don't make him play around with those still water. Oh, that's the best option. And for feline Leptospira, feline are actually more resistant to the leptospirosis, although some suggest it's underestimated. But until there's some study, otherwise, right now, cats are considered more resistant. It's actually more resistant to the Leptospira. We just don't know the actual prevalence of the feline leptospirosis, but they are more resistant to the leptospirosis, that's for sure. Okay, and then that's it for today's lecture. And thank you for attending today's webinar. And we hope to see you again on our next webinar. Thank you and good night.